Hello, everyone, and welcome to the Health Go Live webinar series. Today's episode is brought to you by our friends at Wheel. Just a few housekeeping items to go over. We would like to remind everyone that the Q&A feature will be available, so feel free to send in those questions for panelists throughout the discussion. Stay on after the webinar for a relaxing meditation with Kramer. And with that, I will throw it over to our moderator who joins us from Rock Health, Sari Kaganov.
Hello, ladies. So kicking things off, I'd love if you could each introduce yourselves and also tell us a little bit about what drove you to get into digital health in the first place. And maybe we'll start with Michelle here.
Hi, I'm Michelle Davey. I'm the CEO and co-founder of Wheel. And at Wheel, we enable companies to easily launch and scale their virtual care offerings by providing the clinical infrastructure and clinical networks for care delivery, all under their own brand. And so I got into digital health actually due to my personal life. So I grew up in a rural part of Texas without access to care and went undiagnosed with an autoimmune condition for over 15 years. So as a founder who's been wronged by the system for over a decade, it really drew me to the impact that digital health and virtual care could make in communities like those that I grew up in.
Great, thank you. Allison, you wanted to go next?
Yes, thank you so much for having me. Excited to be here. I'm Allison Watson, founder and CEO of Modern Health, and we are a mental health benefits platform for employers. So we work with employers to make it easier for their employees to get access to mental health resources, and that's anything from digital content, meditation library, digital courses that help treat things like depression, to virtual mental health coaching, to one-on-one therapy, group sessions, and so forth. And, a little bit about, I guess, my background and reason for getting into the mental health space is, so my background's in the healthcare and benefits space. I worked in healthcare consulting and then worked in the digital health space for a number of years before starting Modern Health. And really what I mean is that there's this big unmet opportunity in the mental health space to take a much more proactive and preventative approach to our mental health. When most people think about mental health, they think about people in crisis mode, right? They think about people in the red zone. And we think about mental health very similar to physical health. So we think about it on this spectrum from green to red, and it ebbs and flows at different points in our life. I'm sure we're all feeling a little red zone right now. But the idea is that let's get people to engage before they get to that red, get people to take a much more proactive and preventative approach to their mental health, just like we know it's important to do that with our physical health. And so that's really the idea behind Modern Health, is to create a solution that has a really great user experience and gets everyone to proactively engage and prioritize their mental health.
Great, thank you. Marissa.
Hi, everyone. I'm Marissa. I am the Director of Clinical Operations at GoodRx, and I focus on the telemedicine side. GoodRx is really dedicated to increasing access to affordable prescriptions and with telemedicine healthcare. It is predominantly primary care, but of course we take care of a wide range of conditions. My journey into telemedicine and digital health was actually a little bit different. I really started, I say my first big kid job was in a nonprofit. I had a wonderful experience, but also understood the budget constraints and grant constraints that often came with that type of role. I worked with the WHO and UNICEF for a little bit, and then I realized the private sector and digital health really had a lot to offer in terms of flexibility and taking risk and being innovative. And so once I was able to actually push myself into startup land and start working on strategy there, I realized there was a lot of opportunity to just be really hands-on and connect with patients in a new way.
Awesome, thank you. And I realize I didn't tell you guys how I actually got into digital health. And that is, I did a brief stint of this healthcare startup when I was at business school. Then I joined McKinsey, as one does, mostly a past student debt. But at McKinsey, I did a digital health project really early on. And I was just it was this wow moment of like, this is the future. I'm like seeing the future about to play out. And that's really what drove me to really focus on digital health at McKinsey for 7 years, and then more recently at Rock Health, where it's kind of the home for digital health. Awesome. Well, thank you all for joining and for sharing a little bit about yourselves and your companies. I really wanted to start us off here today by thinking about similar, kind of what you just mentioned, Allison, around we're all probably in the red zone a little bit. I'd love to explore a little bit of what we've seen happen. And I know on our side at Rock Health, we've recently conducted our consumer adoption survey, which we do annually, and the results are coming out actually next Monday. But of our respondents, 12% reported having a mental health condition, which is up from previously. And of those, 40% said that they have used live video for their mental health condition, and 36% said they use live phone calls for their mental health condition. Similarly, we've seen, obviously in 2020, a huge burst in capital going into digital health companies in the mental and behavioral health space. And in 2020, around 1.8 billion went into that area, which is almost 2 times as much as the previous high watermark. So definitely there's been a flood of kind of movement into the space. But I wanted to hear from each of you. Have you seen an uprise in demand from patients or people in this area, and how is that manifested in each of your businesses? So maybe Allison, you can kick us off here.
Yeah, I'm happy to jump in. So the short answer is yes. And I think what's pretty interesting is a big part of what's driving this, of course, everything that's been going on in the world for the past year and, close to a year and a half now, has been an accelerant for the mental health space and increased demand among members all around the world. But really, even before 2020 started, mental health was already the #1 cause of disability worldwide. So before 2020 even started, the #1 reason that people took a leave of absence from work was already related to mental health. So really this had already to increase demand in the employer space. Employers really started to look at mental health as that 4th pillar of benefits. They have medical, dental, vision, and then they're saying, okay, we need to cover mental health because through traditional methods like health insurance or your EAP, it's really hard to get access for a number of reasons that we could go into. So that started getting employers to really look into the mental health space and say, okay, I'm going to prioritize this for my employees. Now, what's also happened is the way that we work has changed a lot, right? We no longer work 9 to 5 where you go home and you don't have access to a computer and we're not, phones and our laptops and we feet away from where we're checking email and where we're working all day, right? And it's pretty interesting to think about that. That actually is pretty new. Like not that long ago, we were not tethered to technology the way that we are today. And the way that we worked was very different. So we have all these amazing benefits from technology as we innovate, and it's why most of us are here and have joined this call today. But the flip side of that is, how do these things impact our mental health? How can we continue to operate in this world where we get all the massive benefits from technology, but we also give ourselves the tools to be resilient so we can thrive in this world where we can go through a matter of jealousy, sadness, happiness in a matter of 30 seconds just by scrolling on our phone through a social media app. So a big part of what we're trying to do at Modern Health is give so they can build resilience to that, especially in the workforce, in the working world, where we know that the rate of innovation will eventually decline if we don't take care of our minds. And we as humans look pretty much the same as we did hundreds, let alone thousands of years ago. And think about the way technology has advanced even the last decade. So how can I often say it's like we're a V0 operating system in a V1000 world. How can we get ourselves up to that V1000 world so we can continue to take care of our minds, we can continue to innovate? And it really is now it's happening in the workforce. It's front and center with employers. They're realizing that, wow, in order to continue to be a successful business, to be productive, ultimately it does impact their bottom line. We need to invest and prioritize our employees' mental health. And so that coupled with employees being more open and more willing to talk about mental health has overall just increased the employer side, and then just usage with mental health solutions generally as well.
Yeah, that's fascinating. I feel like I need some of those tools. So maybe we'll talk after. Great. Michelle, do you want to tell us a little bit about what you've seen?
Yeah, definitely. So not only has funding increased and we've seen a large entrance from mental health, behavioral health providers, but you're also seeing providers outside of specific behavioral health looking to add additional kind of core competencies in care delivery around behavioral health as well. And so we see that from virtual primary care companies. We see that from large enterprises. We see that from even outside of healthcare, how they're looking at coming into the space as well. So here at Wheel, we really, where we play in the market, we really see everything that's happening. And we've seen a large explosion of companies looking to add mental health care delivery in some way, fashion, or form, whether that be like prescribing layer of psychiatric or the psychotherapy layer of therapy, talk therapy, etc. And so here at Wheel, we've built to clinical networks to support that and support that growth into the space and enable companies who maybe don't focus on behavioral health full time to access clinicians for their patients who are experiencing mental or behavioral issues in that moment. And so that's kind of how we've adapted to that over time. I think the other thing that I want to point out too is not just from the patients, but 2020 and COVID was a historical moment for clinicians as well. There's an incredible amount of burnout already in the clinician community, but then you layer on a global pandemic on top of it. And we've seen staggering effects of that in the clinician community, highest rate of suicide of any industry, including active military. So clinicians are at a breaking point. And so it's not only about how do we support patients, and here at Wheel, we focus on the clinicians, it's also how do we support them through this journey. And while they're experiencing something for the first time in a very heightened sense, both offline in the inpatient environment, but also virtually, and how are we taking care of the providers who are taking care of us?
Yeah. Marissa, you want to share with us what you've seen at GoodRx?
Yeah, absolutely. So I think that GoodRx and Hey Doctor, which is our telemedicine platform, is in a really unique position. We are interacting with patients on a daily basis where they can come directly to us, and a lot of times people are lacking insurance, they don't have access. We've seen with the pandemic that wait times just to get into a primary care office have gone through the roof. A lot of recent studies have even shown that it takes up to 6 weeks, sometimes even 12 weeks if you're in a rural area where there's limited healthcare options. We know that you also have to take time off work, manage transportation, find childcare. The increased demand on telemedicine has really been exponential. And of course, the additional layer of COVID on mental health is very, very significant. So we know that people have been coming to us. We have just about 40 services that we really focus on. These are primary care, urgent care needs. People are coming to us for their acne, hypertension. There's a lot of things that we can really do well and focus on quality via telemedicine. But at the same time, when we're building that relationship between the patient and provider, people are asking for help for mental health. Now, we don't have, or GoodRx at the moment does not have a initiation of anxiety and depression medication. We have a refill. So that's where someone already has an established diagnosis and then can come to us for help on their medication refills. It's a very needed and very used service. However, we have a lot of people coming to us where they need help in the moment. And we know that about 79% of 79% of all anxiety and depression medication are prescribed through primary care providers. So the need has just been reconfirmed and reconfirmed through all of our interactions with patients. And it's just become this clearly hot topic and a focus that it's just vital to the community at the moment.
Yeah. So I'm curious, we've touched upon this a bit, Allison. I think you said it well with the medical, dental, vision, and now mental and behavioral health. How are we thinking about the whole person care together? How do we think about this holistically, where it's not just going to one place for one type of care, going to another place for another type of care? And, you know, wondering how any of your companies are tackling this topic.
Yeah, so yeah, go ahead.
Oh, yeah.
Yeah. So I think first and foremost, when we think about whole person care, we really think about the goal of it, right? So it's about increasing access. While many of us talk about access from a geography or socioeconomic position, whole person access is about increasing availability of the right healthcare provider for a number of conditions at the right time when the patient needs it. And so, for instance, I could be going to my virtual primary care doctor just for a routine checkup, and I indicate that I have acute anxiety. How then can we enable that patient or myself to get the care from the right clinician who specializes in that care. So virtual care has the opportunity to do that seamlessly and drive better outcomes.
I completely agree with what you just shared, Michelle. I would also say that, one of our big focuses at Modern Health is exactly as Michelle mentioned, getting people the right level of care at the right time. And the way that we think about whole person care is, well, when we think about mental health specifically, mental health, again, it's not just people in the red and the crisis mode. We all have mental health. So we think about mental health on the spectrum from green to red. And the way that the population breaks down is a typical bell curve. So you have about 15 to 20% of people in the green, 50 to 60, most of us in the yellow, 15 to 20% in the red. And so how can you get people to, one, proactively engage no matter where they fall in that spectrum, and then two, get them the right level of time. One of the challenges in the mental health space is there is a shortage of mental health providers, right? There are not enough therapists to meet the ever increasing demand. And so what's happening is most mental health providers do not exist. And the reason they don't is completely valid. The national average reimbursement rate for a therapist is like $40 to $60 an hour. So they can barely make a living. They just spent years getting their PhD. You can imagine why they'd say, wait a second, I'm going to get paid way less and have the overhead and the admin of submitting claims when I can get paid $200 when someone walks into my office at point of service. The problem with that model is those who end up seeing a therapist in this day and age is based on who can afford it. It's not based on clinical need. So it's really based on, for the most part, socioeconomic status. And so what happens then is you might have someone who's going and seeing a clinical psychologist who specializes in disorders to talk about their relationship issues or their career development, just because they can afford it. Well, now we're clogging up that system and we have a greater population that is subclinical that might be seeing a therapist that could be solved for in other ways. So how can we build a solution that triages people to the right level of care? So if someone is struggling with depression, we make sure that we leverage the network that we do have a clinical need. And if someone is wanting to just maybe proactively work on mindfulness or meditation or career development, that they can be solved through in other methods, the entire provider network to scale. And I think that's one of the biggest focuses that we have built into our product is triaging individuals to at the right time so that the economics work for everyone, for the employer, the individual, for us, the payer, and ultimately allows us to scale and democratize access to mental health in a much more cost-efficient way.
Allison,
Yeah.
I think you brought up an excellent point. It's just making sure that people actually are referred out and get connected with the right resources at the right time. Something that we do at GoodRx is we have a really strong referral network, and we really work on breaking down those silos and barriers and having a patient really be able to see like the full picture. So from like point A to Z, they understand the point in the process that they're at and they understand where they need to go. I think that a lot of times people are falling out. And in fact, it's not just I think, there's plenty of research that backs this up, that people are falling out of the process simply because they don't understand the healthcare system. And having someone that can hold your hand and knowing that it's not just an MD that can give you assistance, there's plenty of other wonderful resources and experienced individuals and medical providers that can also be providing just as valuable care.
And I'd love to dig into something that both of you touched on briefly, which is the access from a financial perspective. Marissa, correct me if I'm wrong, but GoodRx is primarily self-pay. And Allison, it sounds like Modern Health is primarily through employers. I'm curious how you think about that trade-off. What provides better access? Obviously, one is more out of pocket, but then, I'm just curious how you guys would think about that trade-off.
Absolutely. It's something that core to GoodRx's mission is making healthcare affordable. And we have a very strong, on our prescription side, very strong coupon network. We ensure that medication is at the lowest rate possible, and it really increases access for many patients that typically wouldn't be able to afford their medications. On the telemedicine side, there's a lot of research and work that goes into making sure that our consult fees, though they are cash-based, we are not accepting insurance at the moment, they're just as affordable or even more affordable than a typical copay. So even when people are using insurance, it's very common to get bills in the mail, explanation of benefits, additional costs that were not expected. Having that transparency in price allows people to create a balanced budget and understand exactly where their dollars are going. Insurance, unfortunately, is not transparent. So often when in my previous experience outside of GoodRx, it was so common for people to be getting bills in the mail, and all of a sudden it just completely threw off their monthly budgets when every dollar counts, because they simply didn't understand that a certain lab or a certain visit was going to then be billed on the back end.
I'm happy to speak to the employer side a little bit. But Marissa, thanks for sharing that. That's super interesting to think about. It makes a lot of sense. On the employer side, one of the reasons that we sell is the reality is mental health, getting support for your mental health can be expensive, and similar to getting care for anything related to your medical benefits done, if you were to pay out of pocket, can be expensive as well. And so we want to make sure that this is a solution that everyone can get access to, right? And really democratize access to mental health for everyone. And not just if you work at one of the top tech companies in the US that you get access to mental health, but for everyone else, you don't, right? So how can we build a solution where the economics work and we can offer a cost-effective solution so that the blue collar workforces can get access to this and that we can scale it in an efficient way? And I think one of the things that we looked at, and that was honestly an interesting thing for us to overcome, is when people think about how do you solve mental health, the first thing that people think about is, make it easy to get access to a therapist. Like most of us have gone through the process of trying to find a therapist or health insurance. It's a terrible experience. You can pretty much, you might call 50 different providers and most of them aren't accepting insurance. And those who are, maybe they, aren't in network anymore or are retired or they don't have any room in their practice. And so when people think, how do we solve mental health? That's the first thing they think about. But the problem with that is, one, it candidly is a very old school way of solving mental health, is just connecting to one-on-one. There's obviously a lot of technology we can do to scale that. And we do that ourselves, right? We connect people to one-on-one therapy and build technology for providers so that they can scale. But what can we do beyond that? Because the cost of seeing a therapist, not every employer can pay for that for employees. And so how can we build a solution that gets people to the right level of care, gets them to more cost-effective care that drives outcomes or drives value even more than just one-on-one care? So an analogy I like to give is, let's say that you hurt your knee on running. Do you go right to an orthopedic surgeon and get knee surgery? Or should you see a physical therapist, rest, ice, take Advil, try these things to rehabilitate your knee before you go right and get surgery? So we want to try to mimic the same thing in the mental health space so that we can scale it and make it cost effective for employers so that employees can get access to it and that cost isn't a barrier. Because the entire industry isn't there yet. We're not at a point yet where anyone frankly in the space could go just direct to consumer and we could democratize access. It would still be those who can afford it get access, and for everyone else, they don't. And so that's the biggest focuses of why we've gone through the employer route, so that we can democratize access. And as we get more innovative and have these new cost-effective modalities of care, we can then start to get more of the public to access it and to be able to afford it themselves.
Yeah, that's helpful. Michelle, I'd love to talk to you a little bit about the flip side of the access question from the physician angle. I think you really can help us cover the clinician side here. So thinking about telemedicine from the clinician angle, what are the things we can do or that Wheel can do to help increase that access across the country from the clinician side?
Yeah, so it's no secret if you're in digital health that regulations play a large part in decreasing access to clinical care. So, ultimately, that is why we designed Wheel to sit on top of a virtual care marketplace. So our clinicians, we have over 10,000 clinicians in our network. And ultimately what we do is, instead of having to employ those clinicians in-house yourself, we have all of the technology to load balance that supply and demand in real time across the market. What that allows us to do is have one clinician working for multiple virtual care companies at any given time, so that on one side, our clients aren't having sitting overhead that they're just paying for clinicians, which then translates into higher patient costs. And on the other side, for the clinicians, when they are online, when they are available, they have consistent demand across healthcare companies and can provide care for a number of different services and populations at any given time. So that is our approach to it. And ultimately, it allows our clients to also tap a very vast network of whether that be general practice and primary care clinicians or behavioral health from a psychiatry to psychotherapy, that they can then now start to create this whole person care for their own patients without having to have a large clinical network in-house, which is costly to do and really difficult to manage over time.
Yeah, that's helpful. Great. So shifting gears a little bit, I'd love to dig into this question around point solutions versus ecosystem. So we've seen a lot of ecosystem building or platform building happening in the last year. But obviously there are also niche needs that are very specific either to a certain population or to a particular type of challenge people are facing. So I'd love to hear from each of you. How do you think about the trade-off between having really tailored point solutions versus an ecosystem? Who wants to start?
I can jump in. So I think that GoodRx has a unique perspective because a lot of times people are coming to us for point solutions, but what their visit typically ends up being is more of a holistic approach because we do take care of so much. And I think the broad net that we've thrown out allows us to have a really, one, like I just mentioned, a holistic approach with our patients, but two, we can actually treat most conditions in a mild to moderate sense. And the second that it gets to more complicated, they need more ongoing care, that's when we refer out. And that's really the benefit of having something that is really tailored and really niche. And I think that's absolutely something like Allison is working on, like having something that is just so focused on healthcare, on mental health care is very needed and something that we're currently not doing or would be able to provide. So I do think that the issue with this, though, is that there have been so many barriers and silos between point of care and ecosystems that have allowed it so that patients don't know where they need to be going and aren't able to get that consistent care and have that communication across providers. So having consistent change in who's taking care of you isn't always the best option. And it doesn't have to be like that one MD, but it can be that one organization. The ability to share medical records and actually be able to communicate is going to be incredibly important. I think is actually one of the next steps that improvements in healthcare can get into is ensuring that there's this more consistent communication.
Yeah, and just one quick additional question. If you do find that a patient needs something that GoodRx cannot address, how do you handle that referral?
Yeah, so we actually have a really excellent patient support team and RN team that does a ton of hand-holding and typically warm handoffs to other organizations to ensure that that patient continues to get care. We absolutely do not just kick patients out, be like, oh, sorry, good luck, go find resources. We make sure that they are given at least all of their local resources. There's so many times that we'll literally call insurance companies and be like, hey, where's the next local therapist office that we can refer somebody to? It is very tedious and time consuming, but absolutely worth it.
I'm going to hold on to that tedious time consuming thread. We'll come back to it. But in the meantime, Allison, anything to add on the ecosystem versus point solution?
Yeah, I'm so glad you asked that question because it really was one of the inspirations for modern health. So when we think about the mental health space, there's all these different point solutions out there, right? And in a previous role before starting modern health, I was working in the digital health space. I saw that in the, when we look at that spectrum from green to red, there was different point solutions to cover each of the subsets of this. You might have like a meditation app focused on people in the green, maybe a chat-based coaching app for people in the yellow, and maybe one-on-one therapy for people in the red. And we actually saw that employers were rolling out 3, 4, 5 different solutions to cover that full spectrum. And so not only did that create a fragmented user experience and drive up the cost for the employer, but it didn't allow to really track outcomes and then, coordinate where someone is going once they graduate from therapy and graduate from red and red to yellow and yellow to green. And how do you make sure you do all of that within one umbrella? So that's actually what caused the light bulb to go off for me, because I was working with employers who were rolling out 3 different solutions to cover that full spectrum. And the problem with having that disjointed experience is an employee didn't know where to go. So they'd say, hey, I want to work on mindfulness. Well, somehow they ended up working with a one-on-one therapist, which either drove up the cost for them as a member, or it drove up the cost for the employer. Or maybe you have someone struggling with depression and they ended up, getting sent to a meditation app, and they were like, well, wait a second, this doesn't feel relevant to what I'm going through and doesn't feel like it helps. So now I'm giving up. Mm-hmm. So really there has to be, in the mental health space, it's so important that you have one singular front door that everyone can go to for all of their mental health needs. And then you help them navigate where to go. You personalize the experience based on where their mental health is at. So for Modern Health specifically, the way that it works is you download the app, you take a quick assessment that's clinically validated to understand where your mental health is at. Then you tell us what you want to work on. What are your goals? What are your preferences? What are you hoping to get out of this? And then based on that, we personalize the experience and get you connected to that right level of care. So if you are struggling with depression, you might see a therapist. If you are wanting to work on mindfulness, you might get connected to a coach or a digital solution or a meditation. But you don't have to figure that out on your own. You just come to one singular front door and we get you connected to the right level of care. So I actually think specifically in the mental health space that having a solution that can triage people to the right level of care based on their needs is crucial to ultimately, 1, a long-term successful program, but 2, driving outcomes in the most cost-effective and efficient way. And so I actually think what we've learned is that building that from the ground up is really what's going to drive a successful solution for the employee and the employer versus, hey, let's, join these multiple different solutions together and put them in front of the employee and have them figure out where they need to go.
Yeah. And do you think you would ever combine that with other elements of more physical health?
Yeah, that's a great question. I think so. I think what's really difficult and interesting and creates a big opportunity and challenge in the mental health space is that the way that we diagnose mental health today still is like pretty old school. It's these 5, 7, 9 questionnaires that are self-reported. They ask things that are pretty uncomfortable and can often be pretty invasive. And we as humans are actually not great at self-reporting. So we use these old school questionnaires that have been around for decades. And it's actually pretty interesting to think about. You're like, wait a second, we have autonomous vehicles and, we have robots that can do surgery on someone in another country, through someone else in another country. Yet the way that we figure out our mental health is by answering a 7 questionnaire. Right. So there's clearly a lot of room for innovation in the space. I candidly think we're in the first inning of where mental health can go. I think the flip side of that is there's still stigma associated with mental health. As much as it has become more destigmatized, which is great, right? That's really allowed for more conversation, more people to get help. People are still worried about the idea of having an app on their phone that tracks every single thing that they do, especially if it's through their health plan or their employer, right? How would any of us feel about downloading an app that looks at every single thing, even if it could better track our sentiment and how we respond, how we text, what social media we look at? It still might make us feel a little uncomfortable. So until we get to that point, how can we better self-report? And the reason I bring all of this up is because the connection, where it connects to physical health, is if you break a bone, right, you can get an x-ray. If you have cancer, you can get a diagnosis. You can check your biometrics to look at your health, you track your health outcomes. Much harder to do in the mental health space. It is self-reported and we can't cut open our brains and look inside. So what can we do over time to get better so that we can look at it and have statistically significant data to say, hey, you're struggling with depression, you're at higher risk for diabetes, heart disease, cancer. We know that there's a correlation and there's a lot of research out there that shows that, but how can we get better at predicting it and really showing the connection between physical health and mental health and whether it's the chicken or the egg?
Yeah, that makes sense. Michelle, anything to add?
Yeah, I think, going back to like, what are the barriers to creating something that's a niche solution versus an ecosystem? I think that oftentimes ends up on the clinician side. You have to have access to the right level of providers at the right time to create that. And so Wheel helps a lot of people who maybe started in a point of care solution move more towards the ecosystem to, I think after a while, if you are a point of care solution and more of a niche solution, you start to see other trends of what your patients are starting to ask about. Just like if you were to go into a primary care office in person, you may go in because you have a cold, but then you may say, oh, but I also have this rash and there's these other things going on. And so they have to be able to help with a multitude of solutions. And so Wheel enables companies to move from, oh, we're just treating a very small niche area to there's all of these surrounding areas, comorbidities, things like that, that now we need to solve. But oftentimes it's a different provider, either level or clinician type, whether that be kind of a behavioral health therapist versus a psychiatrist, and getting access to those and getting access to them across the country without having to deal with the regulatory environment. That's really what we're focused on, is how do we enable that move into more of an ecosystem, even if it's not like fully, oh, we're going to do virtual care, behavioral health, and chronic conditions. How do we then support patients better around those niche areas?
Yeah, that's super important. So thinking about how you support the patient holistically, one question on my mind, which also came up in the Q&A, is how do we think about patient data? How do we ensure that the clinician sees all the data that the patient has if they've seen different providers, as well as protecting the patient privacy, but making sure that it really works in a cohesive way, especially if we're looking at multiple providers, multiple solutions, the office they visit down the street, as well as the virtual provider they see sometimes. So how do you think about that? Maybe Marissa, will start with you on this one, because you're often seeing patients that are kind of coming in after having care in a physical setting.
Yeah, absolutely. So typically what happens is we're really relying on patients to self-report and upload their own documents and their own diagnoses and information. We are not always contacting previous providers to confirm. And I think for some things that's totally reasonable. Acne, I do not need to call your dermatologist and ensure that you have acne. I can see that on your face by the images that you provide. For other conditions, sometimes I would like to do that. So we do have a good balance there, and we always are getting permission, and we're always asking and reconfirming quite often, like, this is okay, and they're providing that information that they're comfortable with. We also, of course, are very protective of our PHI. Everything is HIPAA compliant. Everybody is trained. Everybody is very, very cautious and ensures that the minimum number of people are entering a particular chart or someone's information. And the only reason that they should be there is if they're actually providing care to that patient. This is not just some free looky-loo opportunity. This is, you must be benefiting this particular case. I can tell you we are constantly thinking about safety. This is something that is always a high priority. It's particularly at GoodRx. We know that this is something that should never, ever be an afterthought. Everything that we're doing is to ensure that a patient is absolutely aware, given all the information of exactly how their information may possibly be used or looked at, and that they're consenting and understanding that, and not just within a huge long terms of use. We're reconfirming these messages as well. So if you don't happen to click that one link that opens everything up, we're also confirming that in other ways as well.
Great.
So I think,
Go ahead.
sorry. Yeah, I want to chime in there, because I think the real problem is that data in healthcare, regardless if it's in person or virtual care, it's so fragmented. It's all over the place. Typically doesn't live with the patient. They're not the one bringing it around. It is owned by kind of wherever they are at. And up until, recently, a lot of those systems actually, didn't want to share that data. So I think virtual care is very much in the very beginning innings of this. And ultimately, I think that is where advances in the virtual care tech stack and interoperability are helping to kickstart that momentum. So rather than every single company building from the ground up all of their infrastructure, which fragments healthcare, there are building blocks and infrastructure companies being created so that ultimately we're building horizontally versus vertically, and we can start to share that data throughout. So there's aspects of that. Wheel is one of those infrastructure companies where we support, lots of different companies, over 30 different companies now, where we can actually track a patient throughout their journey in virtual care and have that data. There's also things like the SureScripts network that allow you to see, the prescription levels of what patients have received in the past. But unfortunately, data in healthcare has already been imperfect. So what we're doing now, I think, in virtual care is hopefully we're starting to look at, there's challenges in getting that, data from the patient and self-reporting that. And to Marissa's point, like in some of the areas that people are coming in, if it's low acuity, that's okay. But in high acuity spaces, how are we accessing that information? And if they don't have that information, maybe they didn't go into a primary care clinician or a therapist in person, how do we then get that diagnostic or information from the patient, whether that's an at-home lab test or a remote patient monitoring device? How are we collecting that data and using it for clinical decision making?
Yeah, and I really couldn't agree more with you, Michelle. Like, this is something that is needing so much innovation and support, because it would just completely break down silos and just lead to better patient outcomes if we actually had improved communications.
Yeah. Allison, anything to add on the data point?
Yeah, I think, look, in this space, especially in the mental health space, it's table stakes. Like, if someone's in the healthcare space in general, you need to make sure that you are HIPAA compliant, that you have everything in place in order to make someone feel comfortable. And then I would say that the stakes increase by like 100x when you're in the mental health space, because it's such personal information and people need to be able to feel safe, comfortable, and vulnerable. So obviously that's been a top focus for us since day one of building the solution and building Modern Health. And we wouldn't be able to work with employers at the level that we work with them if it wasn't a top priority.
Yeah. So we have only a couple of minutes before we switch to Q&A. So we've mentioned today a couple of times that we're just in the first innings of behavioral health, and especially from a virtual perspective. So I'd love to say, if you fast forward, let's call it 5 to 10 years, where do you see this industry or this sub-industry really heading?
Let's let Allison lead with that one.
Okay, I'll jump in. So I think I agree. I think there's a ton of room for innovation here. And I think that there's a lot that we can do. I think one thing that we've learned that's been really interesting for us in the past year has been around this community focus as a way to solve mental health. So as mental health has become more destigmatized, which is awesome, more people feel comfortable speaking out about their struggles, right? But one thing that we've actually seen is that in this world where we are constantly connected and tethered to technology more than we ever have been before, there is this epidemic of loneliness. So why do we have this epidemic of loneliness in a world more connected than we ever have been before? And that's really because what drives human connection is being able to be your authentic self and really be vulnerable in front of someone else. And so we've seen over the past year that there's been a desire for people to want to heal in these groups where they feel safe, they feel comfortable, and they can connect with folks who maybe have struggled with something similar to them, and that they can share and bond over these similar shared experiences. And so everything from what's going on in the political environment, racial injustice, the environment, pandemic, being home alone right now and struggling with loss of loved ones, or being a new parent with kids without childcare at home right now. So all these things that are shared experiences that are relatable, what we're seeing is that people really want to connect with others who are having that shared experience and then heal in a safe space. And so I think that there's this big movement towards, as we think about mental health, connecting with other people over that shared experience. And so I'm probably not articulating this well, but I think what I'm trying to say is that I think that there is going to be more investment and more desire and more facilitation and platforms that facilitate these healing centers, healing groups, and communities for people to come together and connect with others. And we've seen that firsthand. We tested it out at the beginning of 2020 when the pandemic hit, and we call them circles. They're basically like group sessions that focus on anything from having a DEI expert, create a safe space for folks struggling day in and day out with racial injustice, or for parents, or for those going through grief of loss of a loved one, and creating that safe space. And so we ended up productizing it, and actually anyone in the public can get access to it right now. If you go to circles.modernhealth.com, The feedback has just been overwhelmingly positive, and I really think that just highlights that there is a desire for people to come together and connect and be authentic and be vulnerable.
Yeah, I think I would like to add to that. If I could imagine what digital virtual healthcare will be like in 10 years, I just was kind of laughing because I was thinking back, like, what did my iPhone look like 10 years ago? And it just is so different. Like the screen is so tiny, it felt so much bigger.
10 years ago?
Well,
Yeah.
I knew people with iPhones 10 years ago, right? Like, I don't know if I had one, but
Yeah.
I think they were.
Oh, yeah.
I fully imagine that we are going to be able to really increase the use of telehealth, really be able to have a lot of these stigmatized issues less stigmatized. So the increase of social media with all the cons that are with that also have a lot of pros. People have a lot of ability to be more vulnerable and share and curate what they want to discuss, particularly with issues such as mental health. And having something that you are able to access care, and even if it's not a company that focuses on delivering virtual healthcare like GoodRx is, even if it was just a primary care provider out in the Midwest doing something completely independent, they are then going to be able to integrate and use telehealth more and really expand their reach with their patients and really increase the number of patients that they're going to be able to see. So I think you're going to see a lot of white labeling of telehealth platforms, a lot of just increased comfortability with telehealth, or at least the ability to speak with the provider virtually. And I think that's just going to only benefit health outcomes and really increase provider engagement. Hopefully, fingers crossed.
Yeah, I think adding to that from the provider side, I think we think a lot about what does this look like in 10 years for the clinicians, right? Not just the patients coming in, but ultimately, what do the clinicians need to be able to support their journey through being a in-person clinician now to a virtual clinician? I think we'll see groups in cohorts of clinicians, like some will just be in virtual care clinicians and some may just be in person, but the mass majority is going to interact in an in-person and a virtual environment. And so for Wheel, we think about how do we support them through that, ultimately enabling them to manage their virtual practice all in one place. But then how does that connect to their in-person practice, whether that be at a hospital system or their own family practice or a community center? How do we enable that to ultimately, go back to the very beginning of this? How do we increase access for whole person care? It is starting with making sure that the patients on the other end of this can get access to the right provider at the right time. And so we're always thinking about what is the technology and the tools that the clinicians need in order to make that a reality. Because at the end of the day, if they're not interacting with virtual care and stay in the in-person environment, we all are kind of sitting here saying, like, we have patients coming, but the providers aren't behind it.
Great. Well, thank you all. I'm going to switch to some of the questions that have popped up in the Q&A. So there's a couple of questions here around the role of health navigation tools in supporting referrals to high value, high efficiency providers outside of the platform. And there are other questions similarly around different tiers of clinicians. So how do we think about different types of clinicians who can help on different types of things? I guess similar to what you were talking about before, Allison. Any thoughts on those points?
I'll quickly add, we very much rely on referrals out. GoodRx is really great at taking care of mild to moderate conditions, but sometimes people come to us and we're like, you absolutely need to see someone in person. And we know that there's going to be healthcare conditions that are just best done in person. And we absolutely lean particularly on like medical groups that are really specialized, like ACOG. We lean on those provider networks and look at their listings and really work to connect patients with providers that have very clearly been educated and are involved in these fields. Now, we also very much lean on other types of providers, not just MDs. I am in love with nurse practitioners, PAs. You have entire, like, an RN can go so far with you and really help you in your healthcare journey. And it's actually just a lot of times introducing that idea to a patient, because so often patients who are not typically engaged in healthcare only see MD equals healthcare. And if they don't understand that there is this entire network where it can really be much more holistic, they're not going to be able to get the best outcomes. So that hand holding, and I mentioned earlier, I said like time consuming and tedious, but I didn't want to say that in the negative sense. It's actually really great that we spend a lot of time and really work to create something that's a high quality referral instead of just pushing someone out the door being like, sorry, good luck, hope you figure it out. And sure, tedious, but at the same time, like looking through a listing, I don't know if anyone's favorite thing to do in the whole wide world is look through listings all day, but it's necessary and very important. And I think it also draws back to the mission of we are patient first, and it's okay. Like this is so worth it, and connecting patients. And so often you have to do follow-up and more hand-holding, but there's a lot that goes into it, absolutely, to get people into good hands that can take care of them moving forward.
Yeah. I have a question I'd really like to gear toward Michelle, and this is around what about credentialing and maintaining credentials for clinicians? Any thoughts on that?
Well, so I mean, I think that first and foremost, it is like one of the very first precursor steps in having a clinician network. Doesn't matter if it's an RN or an NP or an ND or a behavioral health specialist, like there is practices to credential a clinician. This is one of the services. Wheel is kind of a full stop service where you go everything from the interviewing to the credentialing. So we credential up to NCQA standards. And so that allows us to make sure that the patients on the other end are receiving the best care possible from the best level of providers. And so not only do we credential them one time, because that's important, that's an extensive background checking, you see all of that, but then we do ongoing monitoring of our entire network every single month. Credentialing itself is a pretty paper heavy process. Like it's not something that has a lot of technology solved. And then you move one step further into credentialing, you have licensure. Licensure is also another area where it's really difficult for clinicians, especially right now in COVID. While like a lot of people think about the emergency waivers allowed people to practice across state lines, that really didn't work out the way everybody thought it was. And most of those have been rolled back for that. And so now it's about how do we enable clinicians to get multiple licenses at a time? And that is another paper heavy process that lives at the state medical boards. But we do help our clinicians do that. And then one step further is payer enrollment. And that is another piece of credentialing that has large barriers to enabling patients to use their insurance for virtual care, and is something that us here at Wheel are starting to solve and rip away some of those barriers. But as you can imagine, with a network of over 10,000 clinicians, that takes time and effort to do that.
Definitely. Allison, question for you, and this is around the stigma around mental health, which was mentioned a bit earlier. So there's a question of whether virtual care can help with the existing stigmas, particularly in certain subcultures around mental health. And do we see more people taking advantages of services because they're virtual?
Yeah, that's a great question. I think the short answer is yes, just by making it easier to access and making it more affordable. I think for us, a big part about mental health and helping to destigmatize it is the user experience. And so everything from how someone gets access, right, making it really simple and easy to download an app or get it through your desktop web, click a couple buttons, and then having access within a matter of seconds. I also think it's really important to part of that member experience to destigmatize mental health. And the way that we do that is by making it more relatable. So instead of saying, hey, this is a for those struggling with depression, we say, what are you going through? Whether it's relationship struggles, maybe getting married, having kids, going through divorce, loss of loved ones, struggling with kids right now at home, right? So all these different things that feel relatable to individuals. And I think that because there traditionally is a stigma with mental health, especially within certain subcultures and especially in certain subpopulations, making these things more relatable and less about like, hey, this is just a topic on mental health or just a solution for those struggling with depression. That helps ultimately get more people to engage in these different populations that traditionally would be very stigmatized.
Yeah, that makes sense. And then we have a couple of questions that are a bit more technical in nature around how each of your platforms enables other companies to use the services for their own members or therapists, for example. So I know Marissa, GoodRx has the marketplace. Maybe you could expand upon that, and then we can sort of shift to some of the others if there's time.
Yeah, so the GoodRx marketplace is a unique offering in terms of looking at all potential or many potential resources for a particular issue. So if you go to the marketplace, you are able to essentially shop around for best price, key points of care, exactly like how you receive that care, what maybe is most appealing to you. A good example of this is I am looking for anxiety care. I am going to the telehealth marketplace, I enter that this is the care I want, and a really nice view shows up where it shows me all of the companies that are currently offering care for my particular condition and shows me prices and allows me to really make an educated choice and go directly to that company. So the marketplace is definitely something that other companies can participate in. I feel free to reach out. I'm happy to connect you. That is a different team, but it is been very beneficial and a wonderful connection to have.
Great. And Michelle, I think Wheel is pretty much built on that premise. So that is what it is. But maybe you can explain to folks a little bit more how it works mechanically.
Yeah, definitely. So we are a B2B company. So our infrastructure and our technology that we built is ultimately to allow companies to stand up their own virtual care delivery, whether that's telemedicine, asynchronous, synchronous, lab testing, remote patient monitoring. So our platform is built, it's a completely API driven platform, all white labeled. So you can put your logo and your brand colors. And that is important, not just because that's cool to have your brand on something, but that continuity of care for the patient as well. If they've built brand trust with your brand up front. I kind of relate it to like you go to a website and it redirects you to a different website, you instantly lose that trust. So we've created that and that ability for you to kind of white label all of that and ultimately receive the care without having to build a entire new platform, which takes over years at a time and millions of dollars to do it really well. And so ultimately that is our whole business model and how people tap into us so that they can use it with their patients in as little as 2 weeks.
That's great. I'm going to focus this question on Allison, and this may be our last one depending on the timing. The question is, what are the main challenges and bottlenecks in interoperability of patient data for telehealth solutions? So we've touched upon this slightly before, but I'd love to hear a little bit more around what are the challenges in interoperability of data?
Yeah, no, that's a great question. I think one is just making sure that people feel comfortable even to engage in something in the first place so that they will share their data and talk to someone and feel like it's protected and they can be vulnerable, right? Especially in the mental health space where it's a very vulnerable topic where you're talking about things that are very personable. And then once you do feel comfortable having that conversation, how can we leverage that data to ultimately just support the member, right? It shouldn't be for anything else other than making sure that that member gets the right level of care and gets triaged. So maybe let's use an example where someone gets connected to a coach. And when they're talking to that coach realizes that even though they self-reported and it didn't identify them as clinical, now that they're talking to them and the coach has been trained in this, they've actually realized that this person is higher risk and should be triaged to a clinical psychologist, as an example. How can we make sure the conversation that that person had with the coach then gets to that therapist in a very seamless way that one, makes the member have the best possible user experience, two, drives outcomes, but three, makes them feel comfortable. So I think it really is based on how you build the systems in the back end and make sure that that person's having a seamless user experience where they don't have to retell their story, right, a number of times, but they also feel really comfortable. And the way that the data has been presented to them that, hey, they've had this conversation with a coach, now they're getting triaged to a clinical psychologist, they're having a conversation with that person, and they feel comfortable with the level of detail that person goes about their first conversation. So I think it's really about the user experience and making sure that people feel comfortable in what they're sharing, but also making sure that they don't have to share their information multiple times, and we can leverage what they have shared to get them the right level of care.
Yeah. And then at Modern Health, do you use your own EMR or you have external vendors that you use?
Yeah, we have built our own, effectively our own version of an EMR internally. We build technology we invest as much, if not more technology in the technology that we build for providers as we do for our members. And so we use technology that allows them to manage their clientele, manage follow-ups, how they get connected to individuals, and so forth.
Great. All right, well, we're at the end of our time. I want to thank you all so much. This has been really informative and a lot of fun as well. So looking forward to the next 10 years where we can hopefully come together again and talk about, wow, imagine back 10 years ago and this was just beginning. So thank you. And now I'll be headed over to meditation with Allie.
Thanks so much.
Thank you.
Thank you to Sari and all of our panelists. If you would like to continue the conversation, please join us on Twitter. And now, please welcome meditation instructor Allie Kramer.
Thank you so much. First off, I just want to say what an incredibly beautiful conversation that you all are having. So thank you so much for welcoming me into this space that is really talking about the next wave in the future of healthcare and the way that it will present itself and be more accessible. So thank you for the work that you're doing. And after all this talking of what the future of healthcare looks like, I just wanted to give you a few minutes of self-care for yourselves as you are out there changing the world. So if you can, let's stand up for a moment. I know we can all get so stuck on Zoom and so focused on what we're doing, but let's get into our bodies for a moment. You can go ahead and stand up. And first, just reach your arms up and just shake everything out. And just start to notice what's going on with your breath. Just give everything a little shake. Get the energy flowing. And then use the inhale to reach your arms all the way up. And you can step your feet a little wider than your shoulders, maybe soften your knees a little bit. And then catch your right wrist with your left hand. And take a side bend way over to the left and reach through the whole right side. And then while you're there, just take a couple of breaths and feel the lungs expanding into the right side. And if you want to tip the underside of the chest up a little bit and feel that. And then maybe tip the chest down a little bit and feel that stretch through the ribs and into the intercostal muscles. And then inhale your way back up. And on the exhale, let's just change sides, real simple. Take it over to the other side. And just start to take a slightly bigger breath now that you've given that tissue of the lungs some space to expand. You know, contracting on the right side to open up the left one. And then inhale your way back up. And on the exhale, take the arms back behind you and see if you can interlace the fingers. Now, if that's not working for you today, you can just stretch the arms back without interlacing. But if you can interlace the fingers, go ahead and do that. Still a soft bend in the knees. Let the shoulder blades come together and get a little broader through the chest. And then just tip the chin up slightly. And as you exhale, just drop the chin in towards the chest. A couple more times like that. On the inhale, lift the chest, lift the chin. And on the exhale, let the chin drop in towards the chest and a slight bow forward. One more time. Inhale, lift the chest, lift the chin. And on your exhale, let everything fold in. And then release your hands and give your shoulders a really good roll. Really good roll. And then one more time, reach the arms up. And this time you're going to catch the left wrist first with the right hand and side bend over to your right. Giving yourself just an easy assist there to get a little bit more range of movement. And then inhale back up and exhale, taking it right over to the other side. Just have this moment to get back into your body, you know, with all these beautiful conceptual ideas running around in our heads. Take this time to be back into the framework of your body. Inhale back up, and on the exhale, take your arms back behind you. And this time, change the interlacing of your fingers if you're interlacing your fingers. And then just noticing how the breath can move the body and create momentum. On the inhale, lift the chest, lift the chin. And on the exhale, drop the chin towards the chest. You can even let the shoulders round a little bit. And then accentuate the opening across the chest. Inhale, lift the chin, big full breath. And on the exhale, just let everything round in. One more time. Inhale, lift the chest, tip the chin up, open the throat. And on the exhale, let everything round. Release the arms, give the shoulders a roll. And then just one more time, shaking out anything that needs to be shaken out. You can twist a little bit. Just get some energy flowing in your body. Whatever you need here. And then go ahead and find your seat. Now, if you're sitting in a chair, perfect. If you can manage to sit on the ground, that's great. Some of you I know like to sit in a cross-legged position, but really anywhere that you can arrive to have the spine long, to balance the skull on top of the stem of the neck. And then before we get started, just one more gentle movement. Let's take a twist. You can take the left hand to the outside of the right side and the right hand back behind you. And if you're in a chair, you can use the chair back here. And just let yourself twist a little bit, turning at the waist. And you might even turn the head so that the chin moves towards the notch of the shoulder and the collarbone. Take one more breath in, lift up a little higher. And on your exhale, twist a little deeper. Come back around to center. Have a moment, just feel the difference, notice. And then take your twisting over to the other side. And so you've got right hand to the outside of the left thigh and left hand back behind you. And doesn't need to be a big movement here, just a little something to loosen the spine. Again, to let energy flow in all these different planes of movement, forward and back, side to side, twisting. And then untwist yourself and come right back around to center. And just notice again, any difference. And then if you feel as if the belly is kind of holding on or gripping to hold you up, let it soften. And trust the incredibly intelligent framework of your body to hold you up here. And then rub your palms together. And then take all of the fingertips and press them together. And this is actually a mudra of focus and concentration. So if you've ever sort of organically brought the hands together like this, it's right in alignment with what it represents, utilizing the facts and the information that we take in to become wisdom. Take the thumbs up towards the center of the forehead, and you can gently press in there. Notice if the chin is still jutting forward, right? We look at screens all day long, and see if you can use the thumbs to just encourage the head to fall back in alignment so the back of the skull lines up with the tailbone. If you're comfortable closing your eyes here, go ahead and close your eyes. If not, keep them open, but see if the gaze can become a little bit less penetrative, a little less seeking, a little more contemplative. And then again, just start to notice your breath. Perhaps now that we've created a little bit of space in the body, you might more freely feel how the circumference of the torso can allow the gentle expansion and contraction. Take one more breath here. Open your mouth and just sigh it out. And then gently release the hands down and turn them downward on your thighs for today. So whatever position your legs are in, let your palms press down, just so you can feel a little bit of the weight of your own arms anchoring you there. Feeling the steadiness. And then just keeping the eyes closed, begin to observe your breath. And initially there might be an impulse to shift it, to make it more yogic or more balanced or bigger or deeper. In this moment, resist the impulse to fix. And simply observe what is there. And if there are sounds in the room around you, or if you think the conditions are not quite ideal for you to find a meditation practice, I invite you to include it all. May we understand that meditation is not an absence of thoughts. It's not a shutting things out. It is a fullness of the present moment. So allow yourself to feel the effects of your conversation, the potential, and the possibility. That you each have a vision of change. And allow that to feel empowering. Just for right now. Acknowledge your part. In shifting the world in a positive direction. Acknowledge your part. Let in the honor of your intention.